Hi, I'm with Dr. Verghese, our keynote speaker from ACC. Dr. Verghese, thank you for that amazing speech. I guess as a fellow in training, we'd just like to ask, what advice would you give to us fellows, young cardiologists up and coming, to be the best doctors we can be?
I think perhaps the thing I would encourage you to do is to hang on to the vision that brought you to medicine in the first place. I think a very interesting thing happens as people go through training is that they sort of forget their ideals. I talk about it as people going from their pre-cynical to their cynical stage.
Yeah.
The good news is I think we all come out at the end to some version of ourselves, a better, higher self. But especially during training, I think the intensity of it can make you sort of jaded and start to sort of think in terms of the case that's next and the heart failure in bed 3 and the MI in bed 4, as opposed to the recognition that this is someone's father, mother, parent, brother, and keeping that humanity alive. It's something that I think you have to remind yourself of all the time. And it's hard to do given the pressures of time.
Yeah, absolutely. Do you think that as attendings that we'll have more time to be that compassionate doctor? Maybe practice what we were taught and why we wanted to become doctors in the first place?
I think as attending you have more responsibility to model the kind of interaction that you think is powerful. For example, I'll never forget, I had an ICU attending who always insisted that as we presented the patient in the ICU, we put our hand on the patient. And that changed everything. Here was a patient who otherwise was completely out of it.
Right.
All they meant to us was their creatinine, their FiO2, their this and that. Putting the hand on the patient, he wanted us to say a few words about who this was, and then tell us about the creatinine and everything else. Completely changed the way we approach things, and I think that sort of stuff is what a good attending can do.
Great.
Can model really good interactions with the patient, with the family, and can model the sort of respect that we need to give patients for whom this is not routine.
Right.
It's routine for you, it's not routine for them.
Right. Thank you so much, sir.